Yes.
Sarah John is a 17-year-old college student, is brought to you for evaluation of absent of onset of menses. History indicates that she experienced growth spurt at the age of 11. Her breast and pubic hair development began approximately 5 years ago. She has no other medical condition and takes no medications. She is not sexually active. There's no history of cyclical abdominal pain. Examination reveals breast and pubic hair tan is stage 4.
She's sexually active, okay?
She's sexually active.
Yeah.
Oh, she's sexually active. Okay, ma'am. Breast and pubic hair are good. Tan is stage 5. She appears to be appropriate height. Her abdominal examination is normal. Local examination is normal. Uterus is felt. Investigations done shows that blood test LH is 0.9, FSH is 0.8, so it's hypo. Prolactin is elevated, 1000 international units. Estradiol is 2200. Progesterone is 106, ma'am. So I think her ovaries are good, ma'am. Her estradiol is good, but there is an hypo. The FSH and LH is low, and the prolactin is high, ma'am. So the first thing is pregnancy, ma'am, obviously.
Very nice. Good. Okay. Sorry, that was a question. Was not sexually active. She is sexually active. Very typical presentation of a sexually active females. Definitely a primary amenorrhea patient ruling out pregnancy is really difficult, but definitely according to her presentation and also because of hormonal profile, she does not suit any other than the pregnancy. Everything FSH, LH will be very low and all other hormones will be very high. Okay, very nice. Good one.
Ma'am.
Okay. Yeah, Neha?
Can you please tell the normal levels of FSH and LH?
2 to 10. Just remember 2 to 10 usually is 4 to 10 is normal. 4 to 10 you can consider as normal.
For both of them?
For both of them. Okay, but in exam they usually give it in exam. Don't worry. Okay. So I think everybody...
Prolactin, sorry ma'am, prolactin is the cue, no ma'am? Prolactin is raised, so we have to think about...
Prolactin is high. Estradiol is high and feedback hormones are low.
Okay.
And everything else is normal. And she is sexually active also. So I think everybody knows that patient with the primary amenorrhea, whoever presents to you, you have to first see the secondary sexual characters. If they are there, that means ovaries are working normally. So we have to see the uterus by ultrasound. If the secondary sexual characters are not there, then FSH and estradiol levels are checked. And if any one of them are elevated or both of them are good, if FSH is both are low, that means the level of pituitary only they are having a problem. FSH is high, estradiol is low, that means at the level of ovaries there is a problem. So you have to diagnose the case based on that. In the patients who present with the secondary amenorrhea, first thing you need to rule out is always a pregnancy. Then according to her symptomatology, you can do the test and come to the conclusion whether it is ovarian, hypothalamic pituitary or other outflow tract obstruction.